Good evening, ladies and gentlemen, and thank you, Dr. Arim, for the nice introduction. So, over the upcoming 20 minutes or so, I'll be covering a topic which was almost impossible to achieve before. I'll be talking about Olumiant achieving the impossible for alopecia areata patients. But before I start, Lily gave clear instructions that I'm not allowed to talk about off-label indications, although there are a lot of new off-label things coming. So, how do I start this? Okay, so basically the video is about off-label indications. Okay, so those of us who have been practicing dermatology for 10 years and more know exactly that before alopecia areata, severe cases of alopecia areata and very severe cases were almost impossible to treat. Treatment-based algorithm was basically based on the age group. So if we had patients 10 years of age or less, we had very few. So if we had patients 10 years or less, we had very few options, such as topical steroids and topical minoxidil. Whereas 10 years and above, it depends on the extent of the disease. So if it involves 50%, or less of the scalp, then we can use topical corticosteroids, intralesional corticosteroids, and topical minoxidil. And if this is successful, then we will continue. If not, then we use topical immune therapy. Whereas if it involves more than 50% of the scalp, then we have the choice of either using just a wig or topical immune therapy or topical corticosteroids, intralesional corticosteroids, or topical minoxidil, or recently JAK inhibitors. If this is successful, we will continue. If not, then we will go back to topical immune therapy. So, until recently, no treatment was approved by the EMA or the FDA for alopecia areata. Different treatment modalities had very limited efficacy, and results were very unsatisfactory. So it was not until May 2023 when we all woke up with this breaking news of finally JAK inhibitor approved by the FDA, Olumiant, baricitinib, trials have reached phase 3 clinical trials and have been approved for the treatment of severe and very severe alopecia areata. The study design was called BRAVE-1 and BRAVE-2. It is a randomized controlled trial conducted over 36 weeks. It was a randomized trial conducted over 2 groups where The Brave One, it was over 10 different countries, where Brave One included 654 patients, and Brave Two included 546 patients. The initial phase of the trial was 36 points, and at this point, the primary endpoint was SALT score of 20 or less. There were a lot of secondary endpoints also. So patients were, eligibility criteria includes patients age 18 to 60 years for males and 18 to 70 years for females. And the reason for the age limit is 60 or 70 is to avoid including patients with severe alopecia with severe androgenetic alopecia, because as we age, we're more likely to get androgenetic alopecia. Eligibility criteria also includes hair loss involving 50% of the scalp as measured by the SALT score. So this is severe and very severe alopecia. Severe alopecia is 50% to 94%, and very severe is 94 and above. The current episode of alopecia areata is 6 months. So this is to avoid spontaneous remission, and less than 8 years unless there were episodes, because as you know, more than 8 years would result in less likely achieving the wanted results. And unless, of course, there were episodes of relapses and remissions over the 8 years, then patients were also included. So the primary endpoint was at 36 weeks. It was then there was the long-term extension all the way to 104 weeks. During the long-term extension, the placebo group were re-randomized to receive either Olumiant 2 milligrams or 4 milligrams. And then there is the, what we call a bridging extension, which is from 52 weeks all the way to 200 weeks. So most of the 1,200 patients enrolled in the study in Brave 1 and Brave 2 were a SALT score of 95 and above. A little bit about the baseline characteristics. They were mainly females. Mean age was 37. Mean duration was 3.9 years. Median SALT score is 96. Exposed to one or more treatment in 90% of the cases. More than 50% were exposed to systemic immune suppressants. Mean age was 37.5, mean disease duration was 12.2. There were significant gaps or no notable eyebrows or eyelashes in 69 to 58% of the patients. So, here, so in both trials, a greater proportion of patients on Olumiant achieved a SALT score of 20 or less at week 36 versus placebo. As you can see here, this is at week 36. You can see 34% of the patients on Olumiant 40 milligrams and 20% of the patients on Olumiant 2 milligrams, and only 4% of the patients on Olumiant, on the placebo group. And as a result, as the study continued, results also improved. So the proportion of patients with SALT 50 over time in Brave 1 and Brave 2, SALT 50 is 50% improvement from baseline. So suppose at baseline the SALT score was 70, 50% improvement is SALT score 20. So at week 36, as you can see here in Brave 1, at 4 milligrams Olumiant, 46.3% of the patients enrolled achieved the SALT 50, 30.4 on the 4 milligrams, on the 2 milligrams, and 12.7 in the placebo group. Results were almost similar in the Brave 2 study. So this is by severity, a SALT score of 20 or less at week 36. By baseline severity, severe and very severe cases in BRAVE 1 and BRAVE 2. Those on 4 milligrams in the severe cases, 50.4 achieved the desired results on the 4 milligrams group, 36.4 in the 2 milligrams group from the severe, and same was in BRAVE 2, 44.3 in 4 milligrams and 28.6 this is in the severe group. In the very severe group, results were also promising, but they were less. As you can see here, 21.6 in the 4 milligrams, 21 in the BRAVE 2, and 11.2 in the 2 milligrams versus placebo, only 1%. And results were almost similar in the BRAVE 2. So in both trials, clinically, more patients on Olumiant 4 milligrams achieved a clinician-reported outcome of eyebrows or eyelashes of 0 or 1. That is, this means normal eyebrows, eyelashes, or almost no gaps. This is at week 36. As you can see here on the 4 milligrams group in BRAVE 1, for the eyebrows, it's 44% in the 4 milligrams and 23% it's 33% on 4 milligrams and 16% versus 4% in the placebo. This is at 36 weeks, and results continue to improve. So here you can see real cases. This is at baseline. SALT score was 87 at week 36. SALT score improved to 16. At week 52, SALT score, there was almost complete hair regrowth. And the same is for the second patient. So we've seen the results, but what about the side effects? You see, most adverse events were in the mild to moderate severity. Those include upper respiratory tract infection, nasopharyngitis, headache, acne, and elevated blood CK level. There were no deaths. There were infections, serious infections such as pyelonephritis and COVID-19 pneumonia occurred in 9 patients, as you can see here. Herpes zoster occurred, but it also occurred in the placebo group, and it was a localized herpes zoster. Herpes simplex, on the other hand, occurred, but it occurred more in the placebo group. As you can see here, 12 in the placebo group. Herpes simplex, by the way, occurs more in patients on Olumiant that have atopic dermatitis than in those who have alopecia areata. But acne, on the other hand, is the other way around. Non-melanoma skin cancer. There was one case of non-melanoma skin cancer, which was excised. It was in the 2 milligram group, and the patient continued the treatment. Malignancies excluding non-melanoma cancer. There was one case in the placebo group, which was prostate cancer, one case of breast CA in the 4 milligram group, and another case of B-cell lymphoma in the 4 milligram group. Major adverse cardiovascular events here. There was one case of myocardial infarction in a patient who had risk factors, such as AF and high cholesterol, obesity, etc., etc. So this was the first observed real-life case, and the patient described her feeling as being, it was a very big blow. I was young and was wondering why me, and this is what happens with the patients. So here, this is baseline, this is 6 months, and this is at 9 months. So what's the recommended dose? It's 4 milligrams once daily. However, the 2 milligram formulations are available. Those are for patients taking probenecid, this treatment for gout, or patients with creatinine clearance of 30 to 60 milligrams. The patients aged 75 and above may also consider taking 2 milligrams, and patients with chronic history or a history of recurrent infection. And patients who have achieved sustained control of the disease at 4 milligrams, we may taper the dose later on to 2 milligrams. Pregnancy, it's contraindicated in pregnancy, and if a lady is planning to conceive, then she should stop at least 1 week before conceiving. Live attenuated vaccines should be taken prior to taking the treatment. Monitoring, before starting treatment, we do TB spot test, we do hepatitis screening, we do a full blood count, liver enzymes, lipids may be done before starting, or we may do after 3 months of starting medication. Renal function is necessary. So during routine follow-ups, we do a CBC and liver enzymes. And we monitor the lipid profile every 3 months. So we've seen the cases from Lily. How about our cases? As you can see here, this patient is a 31-year-old. He had so many treatments before. He had topical, systemic medications, but then he was started, his SALT score at the beginning was 70%, but then he was started on 4 milligrams, and this is the result after 4 months only. This is another patient, a 24-year-old. He tried so many medications. He's just starting his life, his career. His SALT score was 90% in the beginning, and then after 2 months only, it went to 20%. And this third case is a 44-year-old. Her SALT score before treatment was 70%. After 2 months only, it went to 40%. So Olumiant is just the beginning. It's a promising medication. There are other indications coming. There are other medications soon to be approved for alopecia. And let me just say, pediatric age group, hang in there, 2 years to 17 years. Just hang in there, there's good news coming I'm not supposed to talk about. There are the JAKis which are specific and much less side effects also coming. There are new tapering ways, not FDA approved yet, but they were mentioned in the American Academy. And so this is just the beginning, and a lot is yet to come. Let me also mention that in January 2023, the EMA's Human Medicine Committee, the CHUM, endorsed measures recommended by the Pharmacovigilance Risk Assessment Committee, the PRAC, to minimize risk of serious side effects of JAKis. We should only include those patients who are not suitable for other treatment alternatives, and we should minimize patients over 65 with high risk of cardiovascular problems, smokers, history of CA, or a history of risk factors for clots in the lungs or DVT. And clinical trials were done on Xeljanz and observational trials on Olumiant, and there are other trials for other JAKis. With that, I conclude. Thank you.